Welcome back, everybody. Hey, I'm Carl Rosen. I'm an ophthalmologist in Anchorage, Alaska, oculoplastics. I'm a member of ASOPers, American Society of Oculoplastic and Reconstructive Surgeons. Fellowship trained, board certified, as is my friend and colleague, Dr. Jon Ditkoff in New Jersey, cornea and anterior segment. So we are going to talk about allergic conjunctivitis and the two main varieties, which is acute, when you're allergic to something particular, something specific like cat dander or hair from a dog or an animal, soap, something as such as that, or perennial, where it just happens all year long, and it causes inflammation, it causes watery eyes, discharge, itching. Itching is the cardinal feature for allergies as opposed to other types of conjunctivitis, such as bacterial or viral. They have different symptomatology. So we're going to focus in on and demystify allergic conjunctivitis, acute versus chronic or perennial, as we call it. Jon?
First of all, I have to compliment you pulling off that word conjunctivitis, because I don't think I've ever said that word, but that was really nice.
I've been working on that all day.
And nice to see you. I hope everything's great in Alaska. I hope it's
Nice to see you too, Jon.
Yeah, so I think the first thing we think about with allergic conjunctivitis is this what the person has? So a lot of people come into the office with conjunctivitis. They have what they think of as pink eye, or their eyes are red and inflamed. And just like Carl said, the key feature, although you can get it with other diseases, I find with allergies or allergic conjunctivitis, there's almost always going to be itching. And I mean, dry eye can cause some itching and infections can cause some itching, but the cardinal symptom with allergies is going to be itching is the main symptom. That's what I'll ask the person. I'll say, what's your main symptom? What's bothering you? Other than it being red, typically with allergic conjunctivitis, they're not complaining of visual issues, floaters, any of those issues, or even pain. It's really going to be just an uncomfortable eye that's itching a lot, maybe tearing a little bit, maybe swollen a little bit, and definitely red. So, yeah, so I mean, when I see a person like that, like Carl mentioned, history is going to be very important. I mean, is this a 15-year-old kid who gets this every time in March, April, May? Or is this someone who just started a new skin product or a new eye drop, and they're having an acute reaction related to that specific thing, like the soap he mentioned or anything like that?
Right.
Let's start out talking about more about the seasonal or perennial. So you have these people that are eye allergy people. They kind of know it. They come in, they say, yeah, I'm allergic. I'm an allergy sufferer. I get my hay fever. I get all this other stuff. And they're also getting eye symptoms.
Right.
So what do you do, Carl, when you see someone like that?
Yeah. So, Alpha-GAN, there's glaucoma drops that cause trouble.
That's a good example.
Alpha-GAN causes trouble. Sometimes pilocarpine can cause trouble, even
Brimonidine.
And these are glaucoma drops that we see oftentimes give people itching. Even after a period of time, like a year, they can develop a sensitivity to it. But I do want to show you a typical patient.
One thing, Carl, let me just mention, because you mentioned about the drops.
Yeah.
As a dry eye specialist, I see a lot of patients who first they start dry eye drops. They use, the artificial tears over the counter. And then after about a month or two, they start developing symptoms like you just described, actually from the drop, and they need to go to preservative free. So really any eye drop can cause an allergic conjunctivitis. But again, we're going to start out talking, well, let me see what the picture you show us.
Right. So here, let's take a look at this. So this is what an allergic conjunctivitis patient walks in. You can see it looks like jelly on the eye. This is we call chemosis. This is the conjunctiva that has fluid underneath it. You see the redness. The tissue looks, we call crepe, or it has a crinkly, shiny look to it. That usually happens with folks that have more chronic, or we call perennial conjunctivitis, allergic conjunctivitis. But there's swelling. You can have bloodshot eyes. And Jon, what do you normally see?
Well, it's interesting. I mean, a lot of my patients will say, can't be allergies. It's only one eye. They're wrong. I mean, it is more typical in both eyes, But I have seen patients over the years where they came with allergic conjunctivitis, just one eye, and maybe if you waited another few days, it would be in the other eye. But yeah, I mean, I look at this patient, I think the chemosis is definitely telltale, especially with itching, that it's an allergic reaction. And this is very acute. I mean, this person is going to be uncomfortable. They might need really strong medication to get them comfortable right away. I mean, I typically don't like to use steroids unless it's really absolutely necessary. So I might start them with an antihistamine mast cell stabilizer. So a lot of people out there that, there's general categories of treatment. So eye drops, which are antihistamines, are mimicking what you take by a pill, like Claritin or Benadryl. Those are antihistamine pills. We as eye doctors use a lot of antihistamine eye drops. Now, if it's just an antihistamine, what that means is it blocks histamine. So it actually causes decreased reaction from an allergic reaction. And it's great. It works. It decreases itching. It's nice. But most of the eye drops over the counter now, they used to be prescription, but most of the ones that are available, such as Pataday, Bepreve. Well, Bepreve, I think, is still prescription. But Pataday is over the counter. Zaditor, over the counter. They're kind of cool because they have two properties. They're an antihistamine, which means they work to stop this reaction that you're seeing. But also, if you use them regularly for a week or two, they actually have what's called mast cell stabilization. So they actually prevent allergies. So if you know someone's going to have an allergy that's going to be going on for a month, you might tell them, keep using this drop regularly. So not only does it work that day, but it blocks the allergy that's coming in 2 or 3 weeks. So this person, I think if, let's say we decide this person's acute. I mean, they've never had it before. It's the first time they had it. They know they put something in their eye, like a makeup or something like that. I would probably just give them an antihistamine, and then if they're not responding, I would give them a steroid drop, such as prednisolone or Durezol or any of those, because really when it's that inflamed, they might need a steroid, but that's going to be short term. I don't want them to stay on a steroid long term because that has side effects.
Right. I also like Acular or non-steroidal.
Yeah, Acular is a good thought. Yeah.
So I do use that. I employ that. But just a cold compress. I mean, ice reduces the enzymatic activity. It lowers the curve, and so the inflammatory processes can't function. They can't continue when you cool down at temperature. So a washcloth in ice water really is great.
Great idea.
And then the other thing is try to figure out what allergy or what allergen is causing the problem, and you may need an allergist to do skin testing.
So Carl, just so you know, in my office, we've been doing allergy tests for years.
Is that right?
Yeah, we check 60 antigens that are common in New Jersey. If they design the test for you, they would design a different test actually in Alaska. But we have a skin test that we do in our office. It's covered by insurance.
Yeah.
It's quick and easy, doesn't hurt. And we can see what the person reacts to. Sometimes I still send them to an allergist because they have a little more exact testing. And I mean, that's their expertise. But if we're just looking for a quick answer to see, and on our test, we'll check dogs, cats, a lot of the common trees, ragweed, dust, mold, things that are around New Jersey.
Yeah. Uncommon things that can do it, which I've seen, is nickel, and that can be a contaminant in jewelry.
Oh, yeah, good thought.
And then perfumes, or even nail polish remover that floats up can give people periorbital edema and can cause an allergic reaction around their eyes.
Yeah, good thought.
Yeah, so Jon, great discussion. We just wanted to give an introduction, talk about acute versus perennial or more chronic allergic conjunctivitis. And I think that was informative. I learned a lot. Thank you, everyone.
I always learn from listening to Carl.
That's right. And I learned from Jon. So long, everybody. Thank you. And we'll see you on the next one.